Let's start. Hello, good morning, Annie George. We are so
Good
happy
morning,
to have
Shamini.
you. We are so happy to have you here because it's one of the most important topics that I have been looking to record on this topic since a long time. Why? Because it affects at least 1 in 4 women. And I was so surprised to see the statistics, and even my community women, they have been complaining about it. What is it? It is the genitourinary syndrome, right? The symptoms that happens during menopause, and especially the one that takes up the top, urinary incontinence, the urinary leakages. I would love to hear more about what we can do. What is it first? Why does it happen? And what we can do about it? Do you see patients and how do you treat them? Maybe I don't want to add the list more now. Maybe in between I'll I'll break it up the questions. Over to you, Annie, and we are very happy to have you here.
Yeah.
Take you.
Thank you, Sharmi, so much. And I'm so glad that a lot of people like you are taking it so seriously and so passionately to educate women. So, like you said, menopause. Always we think menopause, the first thing that comes to our mind is probably the final end of our so called monthly cycles. Yes,
Yeah.
that is one probably good factor that we feel that, okay, we don't have to keep, checking behind us. But menopause doesn't just come with the stoppage or, end of our monthly cycles. It comes with a lot of baggage. So, like you said, urinary incontinence. Yes, urinary incontinence can become worse during menopause. It's not that it may only start at menopause. So, a lot of women would face urinary incontinence or leakage in different parts of their lives. We may think, okay, it's only going to be seen in postnatal women, women who have delivered kids, or women after about 10, 15 years of their delivery. No, I have also seen cases where unmarried women, who are into sports also suffer with incontinence.
Very important information. This was my question. I wanted to ask, is it only during the menopause, or how can one be prepared for it? Even if it can happen any ages, then they are very prepared for it, right? It's a valuable information. Yeah.
Correct. So once I had a 22-year-old girl who was, I would say, woman who was in her, she was into sports, but she came in with a complaint of urinary incontinence. So we always think, no, it is someone who's probably had a vaginal delivery, or someone who's had some kind of surgery down there, and henceforth they have these kind of issues. But you can understand urinary incontinence. There are different types. So we mainly find out as to which category they come into. Is it someone who just leaks while pressure is there? So, like when I say pressure, it can be sneezing, coughing, jumping, any kind of exercise activity. So,
Stress
in those kind of
continence.
women, yes,
Stress
is stress
incontinence.
incontinence. Yes, so women who have stress incontinence, it can be for even reasons when their pelvic floor muscles are too tight. They're
Okay.
not
Oh,
able to relax. So
yes.
it keeps on instigating the bladder to keep emptying. Even though the bladder is not full, it will keep emptying frequently. Another kind of incontinence is the urge incontinence that we see mostly in the perimenopause and menopause women. That is, they keep going to the washroom to empty their bladder. You see, unfortunately I didn't bring my, so we can fill our bladder quite full, like for 4 hours we don't need to really use the washroom. But a lot of women who would have had one or two leakages in their life would always have that psychological worry. Okay, am I going to leak? Am I is it going to happen now? So before they leave the home they use the washroom. As soon as they reach another destination they use the washroom. So what happens is they've retrained their brain to keep using the washroom at a particular frequency.
Yes, I heard about this. This is like you're training the against your nature. Yeah, just to
Yeah,
out of the circumstances, right? Yeah.
yes.
Urge. Yeah.
God has God has prepared us to hold enough of urine in our bladder that we don't need to go every half an hour to the washroom, unless and until you are having something that is irritating your bladder. Bladder irritants like caffeine, alcohol, smoking, all those can be bladder irritants. Yes, you will frequently use the washroom. Or else if you're having infections, urinary tract
Yeah.
infections, all these can also increase your washroom visits. But other than that, on a normal basis, you don't need to keep using the washroom. Like we always say, what if I don't find a good washroom outside?
Yeah,
Which is a
yeah.
very common issue. Yeah, very common issue we find in India. I
Yeah.
also had similarly 2 years back. I had a young lady. She had come to me with an issue of uh, she mainly came because she had a very tight pelvic floor musculature. So when I kept asking her, she said, "I have a problem that I get frequently urinary tract infections." So when
Mm.
your urinary tract infections keep increasing, also you are putting your pelvic floor muscles into trauma. So
Mm.
there it either it gets very tight, so
Mm.
this also in a later run will increase her visits to the washroom. So when I
Mm.
asked her about her urinary tract infection, she explained to me that she travels from quite far to her workplace and she
Mm.
uses the public transport. So she
Oh,
says, because of that, I hold a lot because unfortunately in our country, it's difficult to find good, clean
yeah,
washrooms.
correct.
So
Yeah.
women hold a lot. And that
Yeah.
kind of predestined her to keep getting urinary tract infection. So we worked on her.
So
She's pain
it's
free.
like so it's like basically you should not hold also for too long, and
Too
you
long.
should not
Yes,
even empty it unnecessarily when you don't
very
really
frequently.
call. Out of circumstances, you don't force yourself to empty it. So it's both the
Yes,
extremes, right? Yeah, yeah.
both
That's
things.
information.
So
Yeah.
when I talk about urge incontinence, what if? It's always in the lady's mind. What if I don't find a good washroom outside?
Yeah.
So I
Yeah.
will empty my bladder. She would have emptied her bladder hardly 10 minutes before while
Yeah.
getting dressed. But then
Yeah.
when she reaches the door, she'll be thinking, okay, what if I don't find a washroom
It's a
nearby?
very
Or
common
else a
one.
lot of Yeah, and
Yeah.
a lot of us, if we are doing road travel, how many of us
Mm.
feel very comfortable going out in the open? It's very
Yeah.
difficult.
Yeah.
So there also we try to hold our bladder. There are women who have orthopedical issues that they cannot squat and use the natural restroom outside. So a lot of these factors, contribute also to incontinence. It can be our lifestyle, that is we may have some orthopedic issues that don't allow us to frequently use the washroom, or else we just retrain our brain. So same problem with menopausic women is they have these urge incontinence and stress incontinence. So for urge incontinence we try to teach them to retrain their brain. So I will not say immediately, okay, tomorrow onwards you should only use the washroom 4 times a day. That's not going to happen. I will
Mm.
first ask them to follow something called as a bladder diary. They're going to put up in writing
Wow.
at what time they use the washroom, what did they
Wow.
drink before that, how much
Yeah.
did they drink. So then
Yeah.
we keep understanding what is causing them to use the washroom quite
Oh,
often.
you're basically
And then we
addressing the root cause of it, like what is
root
causing that
cause.
you have to, yeah, yeah. They figure it out by
And
their
we
own if they have a track of it.
correct. And when they see that, they'll also understand, okay, I'm going too often and I think I can like push or eliminate one of those visits. So they
Mm,
try
correct.
to eliminate one visit per day.
Yeah.
And then it takes about 2 3 weeks for you to retrain your brain also.
Mm, yes, true.
So that is also important. So it's not that you can't work on it, but you can work on it. But
Mm.
another factor that I see women coming with incontinence is they would have shown, so stress incontinence is a sign showing that your pelvic floor muscles are weak.
Oh, yeah. Correct.
There are women who only leak when they exercise. There are
Mm.
women who only leak probably during the winter months, like
Yeah.
when they are having chronic cough, cold.
Mm.
So
Mm.
I know a lady who was using a panty liner for about 14 years. She seems
Oh,
comfortable
yeah,
with
they're
it, but
comfortably, they're just going with it, yeah, not fixing the solution problem
not
actually.
fixing.
Yeah.
Correct. And so she told me, like, I've been using it like from the time my baby was born, I've been using a
You
panty
got,
liner. It only
yeah.
gets difficult during the winter months if I fall sick. See,
Mm.
you can work on the root cause, or you can just, apply a band-aid on top and continue life. But what happens? Quality of life is reduced for any
Exactly.
woman. Yeah,
Yes.
we all love to go out, we all love
And
to
also, does
dress
it
well,
lead
but
to
we don't.
infections as well, right? Because continuous
Yes,
moisture there and there are
yes.
other,
And
yes.
because of that, again, she's aggravating her symptoms. So it's
Mm.
very important that we don't put a band-aid. Women shouldn't think that it's okay. After delivery, it's okay to have a bit of leaking. And
Mm.
when I'm a little more older, it will increase. It's part of life. No.
Mm.
And
Mm.
recently also, I'm seeing a lot of advertisements where women after 40, and they're showing women like this, like
Oh,
crooked,
that's
like
very
face.
bad.
Just
That's so
thinking,
sad to.
why do they make look women after 40 so, uh, pitiful and pathetic.
Exactly.
You
Yeah,
know,
we can live a better
women
life.
are,
Just that we have to go with some precautionary steps, like you said, keep a track of the no, the routine, what triggers
bladder
you,
diary.
address the root causes. Yeah, those
Yes.
things
And
can,
if
yeah.
it is a pelvic floor muscle weakness, we work with that. So you need to make sure you go to a pelvic physiotherapist. See,
Oh,
doctors
it's not
can
any
help you.
physiotherapist. It has to be a pelvic, not
No,
any
no,
physiotherapist.
no.
Oh, that's
You need
really
to be
important
certified.
information. Yeah.
Yeah. So see, I also need to be certified as to I have to understand the muscles. Not
Yeah, yeah,
everyone will know about the muscles, how they work, how do we
yeah,
find out when there is an issue.
yeah,
And
yeah.
there are pelvic physios who are also not trained for invasive pelvic physiotherapy.
Okay,
Invasive means we will be able to touch and assess better. you have a
okay.
lot of you have a lot of women's health physiotherapists who only deal with teaching exercises from the external point of view, that is
Mm,
for antenatal women,
mm,
postnatal women. But
mm.
how many of them are able to understand and assess the muscles inside? You need to figure out.
Okay,
So
it
I
depends
would
on
say
the
don't just.
severity also, but it's always better to go with the proper certified pelvic invasive, right? It's called, yeah,
Yes, invasive physiotherapist. So when
physiotherapist.
I talk about muscle weakness, how would I say my patient is having a muscle weakness? Or is my patient having a hypertonus muscle? So we have two dysfunctions in pelvic floor muscles. Either they are very tight, so we say hypertonus, or they are
Mm.
weak, we call hypotonus. Similarly, like
Oh,
we have any muscles
yeah.
in our body, it may go into
Okay.
a tightness or it may go into
Mm,
weakness.
mm,
So addressing it from that point of view is very important. We do a muscle check, we do a muscle
mm,
assessment. Not
mm,
everybody's muscle will be at the same level. So we do it invasively, we check on their muscle strength, and then after like 2 weeks, we again redo the test to see how much of improvement is there. We just can't
mm,
say, okay, you do your exercise, it will improve after 3 months, 6 months. No, we will invasively check. So it may be a little bit of discomfort. I won't say that for some people, there will not be
mm.
any kind of pain, but there will be a little discomfort for someone who has a very tight pelvic floor muscles. They may
Okay.
complain of I find it difficult to use a menstrual cup or a tampon, or any kind of insertion will cause pain in my body. So that is a sign of hypertonus muscles. And
Okay.
hypotonus, that is weak musculature.
Mm, mm,
I find it difficult to cough, sneeze, I'm afraid, you know or I
mm.
don't do any kind of jumping activities because my muscles will leak. So
Oh,
those kind of people, we have to address it differently. And when I say that we re-educate your muscles, we use, so if it's a weak pelvic floor muscle, we use weights. You can see these,
yeah, yeah,
no,
yeah, yeah.
can you
Yes,
see
yes,
these are like
I
metal
very,
balls? Yes.
yeah.
So we use weights inside the apparatus, and
Mm.
we teach them to retrain their pelvic floor muscles. Same way we use weights for all our
Yeah, yeah,
other
yeah.
part of the body.
And also the muscle gets weakened during muscle loss is common in menopause, right? So that could
Why?
also be one of the
Because
triggers. Yeah.
yes, why it becomes weak? Mainly because our estrogen is reduced over there.
Yeah, that, yeah,
So we
yeah, we
have
know that. Yeah.
estrogen receptors all over our body,
Yeah, correct.
especially to all your ovaries, your vagina, your
Yeah, yeah,
brain, your
yeah.
heart, your skin,
Mhm.
the most important
Right.
organ in our body, your skin. So when
Yeah.
all these receptors don't get enough of estrogen, they start,
Mm.
causing small, small weaknesses in your body. That's why they say
Mm.
menopausal women are more prone to cardiovascular issues, because they
Yeah.
had the
Yeah.
protection till then with the estrogen,
Yeah, yeah,
and
yeah.
now the estrogen decline is reducing their protection.
Yeah. No, the
So
muscle loss during menopause also contributes to this pelvic issues that we face
yes,
in the menopause stage.
yes.
Yeah, yeah, I get it. Yeah.
But if you are a woman in your 30s, what we
Mhm.
do is we target women in their 35s onwards. We
Oh, yeah,
start
that's
making
better.
sure they start doing their exercise, pelvic floor exercises, from that time, so that they don't face these issues later on. It's not
Yeah.
that you need to start only in your 60s and 50s. It becomes a little late.
The proactive illness. Be proactive
Yes.
about preventing it. Yeah.
Yeah.
Yeah,
Yeah.
correct.
So when you know that you are leaking, it is very
Mhm.
important you start exercising. You
Yeah.
don't wait, like, so some of them will end up going to the doctor only when they go into something called as a pelvic floor prolapse.
Is there any severities if you miss out the little bit of leakages? What is the severities and when do they reach out to the what is the warning signs that one can look up for? because women
Okay,
generally take it for granted, no? But in general, we advise that they take the preventive measures in the 35 itself. But if they miss it
correct,
out and somebody is in the menopause, like my community, and there they still feel that, okay, it's mild drop, I can ignore it. I mean, what are the warning signs that they should be really be? I know it is always better to go, yeah, as soon as you feel it, but still, what are
correct.
the severities of it and the warning signs one should be looking up, not to
Sure.
overlook? That would be nice.
Yeah.
Yeah.
So, like I told you, it will start with small dribble of urine. That is probably
Yeah.
few drops. Over a
Yeah.
period of time, you will feel a little more quantity being leaked out. And then
Oh.
you will find it even difficult, probably even a small sneeze, you're having a gush of urine leakage.
Yeah.
So, for pelvic floor prolapse, there are different stages. Initially, usually it can be your bladder that is coming, lower. Because why it comes lower? It is losing the support here. This is your pelvic floor muscle. So when this becomes weak, it's going to start hanging down. So what happens? Your bladder, your uterus, your rectum, all those are also going to start going
Coming
lower,
down. Yeah.
coming down. So over a period of time, some women may develop urinary bladder becoming weaker through the vaginal opening. So they
Oh.
say that when I'm passing urine, I feel a heaviness or I feel something coming through my vagina. That is
Mm.
almost in the third or fourth stage. There are four stages for your pelvic floor prolapse.
Oh no.
So
Mm.
usually we ask women, when you pass urine or when you empty your bowel, do you feel a heaviness or do you feel something coming out from there? So these are the signs that they need to look for. Another big important thing is constipation. Chronic constipation also causes pelvic floor weakness.
Oh, okay. Because the rectum is also on the pelvic floor, right? So that
Yes.
will also put the
So you
pressure on it.
imagine
Yeah.
you are straining every day to pass your motion. If you are someone
Yeah.
who's always, let's say, 3 4 days a week, you're constipated, you're again straining up your pelvic floor muscles. So what
Yeah.
happens? Over a period of time, they become weak. They're fed up with
Mm.
all the pressure that is
Correct.
coming into
Correct.
them.
Yeah.
They
Yeah.
become weak.
Mm.
So these are the two main things I would ask women: incontinence and constipation, because
Mm.
these can be precursors into your pelvic floor prolapse in the future.
Prolapse basically means, the organs disposition. They
Are
just take
Yes,
different,
this
yeah, place.
position, yeah,
They come
putting
down.
pressure down.
Yeah, yeah,
Yeah.
and that
So
puts a lot of pressure in your other areas, like especially your,
yes,
the bladder.
the
The
bladder,
yeah.
and even there is also prolapse of your intestines. That is your intestines
Oh,
coming through your vaginal opening. That is in extreme cases.
okay. I heard about uterus prolapse. The womb has come
Uterus,
down.
bladder.
Yeah.
Yeah.
Uh,
So one thing is when it gets too much, we go in for a hysterectomy because you're
mm,
not able to keep your bladder or your uterus in position. You
okay.
tend to go for a hysterectomy, or in
Mm,
some cases they go in for a urinary bladder reconstruction to help
mm,
them retain their bladder
mm.
inside, but then they can still make sure that they're not having the prolapse issues.
Okay.
If it is a little earlier, medically people can use pessary.
Okay.
I think you're familiar with that term, pessary. So these are
No,
ring-like
I am
substances.
familiar, but I would love you to talk about
Yeah.
it for the
So
viewers. Yeah.
pessaries are something that the gynecologist put into your vaginal opening, okay,
Okay.
and it helps to keep your internal organs in place so that it
Mm.
doesn't droop down too much.
Oh,
But
okay.
pessary cannot help you too much in the fourth stage,
Mm,
because by
mm,
then your pelvic floor muscles have become too weak. So you
mm.
really need to make sure that you go in for a reconstruction.
Yeah, yeah.
So these are what happens usually during a pelvic floor prolapse.
Yeah, I mean, I'm trying to have an analogy with a life, with a simple example. Like, you can pelvic floor has all these organs. Like, to
Yes,
conclude all this session, like, you have a bladder, you have the uterus, and you have the rectum there. All these things, when
correct.
during pressure, during menopause, or whatever, when it has not been taken good care, they have a chances of, missing their positions, also because of the muscle loss, and they all can come down, which is called prolapse, pelvic floor prolapse, because that floor holds
Yes,
all these organs, and they can
correct,
prolapse eventually, due to aging or due to other factors, like you told. Um, and then what we can do, there are stages to it. And the last stage is when you see the disposition of all the organs that is coming out. And yeah,
correct.
that is really lovely,
So
information. Yeah.
earlier times when women didn't have access to this, like pelvic floor prolapse, very rarely it is reported unless and until it is causing a lot of discomfort for them. A lot of
Mm-hmm.
women try to push it. They probably would live the rest of their life with incontinence, may not be a prolapse. But
Yeah.
earlier times, I heard a patient of mine telling a story where probably 20, 30 years back, when women had a prolapse, they really didn't know what to do. So someone would give them this idea. A particular person would pick up wood
Mm.
apples from the
Oh,
forest and
ah,
they would push it into their vagina. That was their way of holding the prolapse.
oh my
And
God.
there,
Yeah, is it safe?
and
But
that
I mean,
would
that is
cause, and yeah, it's a
infections.
foreign, yeah, it is a foreign object which is not designed to, fit into that cavity. So for some people, that would cause
Exactly.
severe
I
infection
even, yeah, yeah, yeah. That's
and
so sad.
complications.
Yeah.
Yeah.
I remember my sister had the uterus become, and it has come down. I didn't know this terminology. That then now when I can relate to it, oh my God! And she's not supposed to lift heavy weight, not supposed to
Yes.
climb stairs. Those are the things because it puts stress on their abdomen, right?
Yes.
Yeah, yeah,
Yes.
yeah. So yeah, it's this is a very lovely information shared. And what can is there anything that we can do as preventative steps, like you said,
Yeah.
the exercise, Kegel exercise? Yeah.
Exercise. Kegel exercise, but Kegels cannot be for everyone. So if someone is having a
Mm.
tight pelvic floor muscles, we would not give them Kegels exercise. Instead, we
Mm.
would give them relaxation exercises.
Yeah,
So
opposite.
so honestly, from outside, it is difficult to give just a single exercise to all people. But it's
Mm.
important that you make sure that when you are coughing, sneezing, something that you can do from your end is hold your abdominal muscles tight and try to do the Kegels at that time.
Mhm.
So you're doing three
What
things
is
that,
that? Mm.
so three things that need to do.
Yeah.
When you're going to cough, you
Mm.
exhale, you contract your pelvic floor muscles, which is like your Kegels, and you
Okay.
also hold your stomach muscles tight.
Okay.
Okay.
Okay. Along with the stomach muscle, you have to contract your pelvic the muscles as
Pelvic
well.
floor muscles,
Okay.
and make sure
After
you're
you,
exhaling. So when
yeah.
you're exhaling, you're not building pressure into your abdomen and not pushing down your pelvic floor muscles.
So when you hold, you have
So
to exhale it. When you
exhale.
hold
So
the muscles,
usually
you have to exhale.
exhale. So when you are coughing, make sure you like exhale immediately and you like contract both your stomach and your pelvic floor muscles. So this will reduce the leakage also.
Okay.
So
Okay.
this is
That
what we
is.
teach our patients initially.
Yeah, simplest step for the stage one.
Yeah,
Viewers don't just keep waiting for for it to become worse, or
it will get
like
worse.
yeah, like Dr. Annie here, she's clearly explained that we have to literally take the preventative steps before itself. But in case if you're
Yeah.
missed out, it's still not it can be curable, right? Any stage, but
Yes,
any stage can be curable. The good news is that
yes,
we have treatments available. It's not, but it's always better to get it checked as soon as you feel any of these
correct,
symptoms, right? Yeah.
correct,
Um, uh,
correct.
I wanted to ask something else. Is there any food thing that triggers these, that food, from food point of view, anything that we can avoid if someone is suffering with incontinence?
Caffeine,
Yeah.
alcohol,
Okay.
smoking, a
Oh.
lot of spicy food.
Oh, spicy food.
So
Oh, no. I don't know. I can
not
give
too
away
much
the
spicy.
coffee. Okay. Yeah. Okay. Okay. Yeah.
So
So
that's
health,
something that we can work on. Yeah, and
health for
then it's
health.
very important. Like the
I
Mediterranean
have
kind of
one.
diet.
I have one important question. Sorry to interrupt, Annie. What
Sure.
about women who's experiencing probably the first stage of incontinence? Will they have a chances of leaking urine when they during intercourse?
Yes, yes, yes.
I Yeah.
And that becomes very difficult for them. So what
Yeah,
do
it
they do?
becomes very uneasy, embarrassing, and other
So
things.
yeah, so they move out from the whole intercourse scenario.
Yeah, yeah, it affects the sexual.
Yes,
Yeah,
sexual dysfunction it causes. So this is only a small issue, but a lot
yeah.
of women will also say, yes, I have such weak pelvic floor muscles, I don't reach any climax. So
Oh,
where your pelvic floor muscles causes issue is same bladder,
mm.
bowel, into your sexual dysfunction and into the rectal issues.
In fact,
So
having a regular sex will also be like a muscle exercise there, right? The men during this time might also, keep
right,
away from the sex, but sex is actually also contributes for them, good, keeping that part very healthy because of
health,
the
yes, it
muscle.
helps
Yeah, it helps as well. Yeah. So,
work. Yes.
is there any word of advice would you say for during the people who shy away during this time? Um,
No, there is no need to shy away. It is our
yeah,
body, and these are
yeah.
functions of our body. So when it is going into dysfunction, it's your body
Mhm.
giving you a sign that it needs help. So
Attention.
we are not living 30 years behind where we can't, we
Fix it.
don't get correct kind of help. Nowadays, we have access to very good kind of help. See, women also who feel shy to go and meet a gynecologist or a pelvic physio in person, there are so many of us who are available also online for consultation. See,
Yeah,
when
yeah.
someone is in this field, there is no need to feel shy. I know it is initially difficult, to come get an assessment done, but then if, think about
You,
your quality of life.
yeah, you do
That will
online
help.
consultation also, Annie. It'll be
The
lovely to
initial part,
my.
yes.
Okay, yes.
At least for the assessment diagnosis part, yes, I do online. Those who cannot
Okay.
access me from too far, yes, I do
Yeah, yeah.
online consultation also.
Yeah, I'm so sorry. I didn't give you a proper introduction. Please,
No
for the
problem.
viewers, they would love to reach out to you. Please introduce yourself. How many years of experience? And yeah, just quickly. Yeah,
Sure.
because.
Hi, I'm Dr. Annie George. I'm a pelvic physiotherapist, a musculoskeletal physiotherapist also. I've been in this field 20 plus years,
Oh,
and I am passionate about women's health physiotherapy. So when I say women's health, it's not going to be only with the antenatal or postnatal patients. We are looking also into pelvic floor dysfunction patients. And I am a strong awareness coach for menopause and perimenopause. So I hope to, reach out to more women because I feel they suffer a lot silently. So I
yeah,
don't want them to go through life like that. Like my priority is your quality of life should be there. We should
yeah.
not compromise. Till our end, we should be happy, healthy, and we should be able to enjoy life. A lot of women say I don't travel because I have incontinence issue. This is sad,
Yes. Yeah,
and
yeah.
things that can be done, we put a lot of money into our insurance and all. Why not our health?
Yeah,
So
sure.
like I said, women after 30, it's good to look into your pelvic floor health also. It's very good also to look into your bone health because all these get compromised after your perimenopause and menopause.
Very truly said. And so, yeah, it was such a lovely session, Annie. Thanks for your introduction. And I'm sure, my community women, whoever is watching this, they please reach out to Annie. She is very good expertise in this area, and you don't have to, look out for search everywhere. Personally, knowing her, like her services, please don't wait till it get, you have to live a better quality of life, like she said. So
Correct.
there are solutions available. There are good practitioners available. So just leaving you all with a good insights, valuable knowledge from Annie, and feel
Thank
free to
you.
reach out to her. And I hope this session was useful to all of you. Thank you so much, Annie, for your time. Take care.
Thank you. Thank you, Sharma. See you.
Yeah.